So that is how we have slowly evolved into this particular business. So just to give you a small introduction about Ambe International, probably doesn't require any introduction. It's one of the largest overseas placement agencies in India, and and they have been in this business for a very, very long time, which is not very common for that companies in that business. So they have something right which is going on for them. So we have Nessie, who is representing Ambe International. And just to set a context for this whole webinar, what we thought is that there would be an introduction as far as this whole career services in Germany. And then we will also take you through, Nessie will take you through some of those interview questions, because we have this client interview coming up on Friday. So we thought that, all of you need to be prepared a little bit as far as that first level of the interview is concerned before we go on with the language process. So Abhilash, you can take over and introduce Nessie, and then we take it over from there. Thank you.
Yes, sir. Good afternoon, everyone. So now I would like to invite Ms. Nessie ma'am from Ambe International to have an overview of this golden opportunity to Germany for the nursing professionals. So let's welcome Ms. Nessie ma'am to head the session. Over to you, ma'am.
Thank you, Abhilash. Thank you, everybody from Mentric for giving me this opportunity to introduce myself. And I would like to tell you, Ambe International was first established in the year 1983. And we are the first recruitment license holder for overseas recruitment in India. So till date, we have placed more than 4 lakh employees across the globe, So this opportunity that has come up for us is for nurses, only for nurses, that is for Germany. And the requirement is of GNM and BSc. That's the minimum qualification that is required. Okay. With if you have experience, if you don't have experience, also it's not a problem. But the requirement eligibility criteria has to be met. So that's the way I said, you have to be minimum a diploma holder, that is GNM or BSc. Okay. Now, what are the top reasons to move to Germany? If you go to see this, economy is quite stable over there. They have huge requirement. There's a shortage of nurses, and the shortage of nurses in 2023 is expected to be 2 lakh. Okay, so you have opportunities over there, and over the period of time, when you move ahead, also the shortage is going to increase because their aging population is more. Okay, so by 2050, it is expected to have a requirement of 5 lakh. So it is a golden opportunity for you to go and settle down over there well in advance. That's one. And this opportunity that is there for you, you need to grab it. And once you have grabbed it and you reach over there, there's nothing like looking back, or you don't have to come back, because they are looking for you to settle down over there. If you be in that country for more than 3 years, you'll get permanent residency. If you be over there for more than 5 years, then in that case, you'll get citizenship. So it's an opportunity for you. You just have to learn the language. Okay, learning language also, there are 4 levels: A1, A2, B1, B2. These 4 levels you will have to complete it before you go to Germany. And this client of ours who's going to take the interview on Friday is particular that you complete B2 level. And while you are in your B2 level, she is assuring that if she has selected you, she will give you a job in Germany. Okay, so what is the most important thing over here is that you learn the language. Okay, so you be in touch with Mentric for the language learning. Complete it. In the meantime, we will get you the employer. Once you have completed the language learning, simultaneously we'll be going through the documents that you have. Whatever is incomplete, you will have to get it done. The most important document is the transcript. So those who don't have a transcript, please apply to your college, because without this, the pro recognition in Germany cannot be done. Pro recognition is where, while you study GNM or BSc in India, you will see that there's a gap between the standards, the standard of India and Germany. So the first 6 months that you go to Germany, you will be in an adaptation program. Okay, so this will be decided whether it is 6 months or 8 months or 9 months, 10 months. It will be decided by the German government by looking at your transcript. Okay, because the transcript gives the number of hours that you have spent in your theory as well as your practical. Okay, so this document is a must. Passport and other documents are also a must only. I won't say that you don't require those documents, but without this document, the pro recognition cannot be done. This is one thing. The next thing that I want to say is we will, like, in terms of Germany and all, like the country is quite safe for girls, especially. Okay, transportation is good. Those who would like to explore the country can move not only to Germany, but with the same visa you can travel to all the European countries. So that's an advantage for you. And education is free. So in case if you think of learning further, like going for a specialization, PhD or masters, then the education is free. The tuition fees is completely free over there. You need to join a public university. So that's a condition. If you go for a private university also, then in that case, you need to make payment, but it is advisable to go to public universities because tuition fees is waived off over there. Coming to the interview questions and answers, the questions would be like the very first question would be you need to introduce yourself. Okay, when we say introduce yourself, you need to go through your life, like like the place you were born, the school that you have been. Okay, the college that you have attended. When you say like you have done a GNM, okay, you need to say that it's a diploma of 3 years. Okay, just saying like abbreviated forms of qualification, don't use that, but you need to be clear that you have done a 3 years diploma in India. Okay, you have to say about the start period and the end period of yours. In the same way, when you say that I have a BSc, you need to say that it's a degree, it's a 4 years degree. Okay, then in case if you have done any internship, you need to speak about it. When you speak about your job also, you need to say like which hospital you have worked, from which period to which period. You just don't have to say like, and most importantly, when they would ask you like what you were doing in a particular day in your job. Okay, so most of the nurses would only say that I did everything. That cannot be the answer. Okay, what you have done from the start of the day till the end of the day, how typical was your day, like in the hospital, that you need to explain it to them. Okay. So these are the things. Then next question is, among all the countries, why did you choose Germany? Okay, so there's a list of reasons why you would need to choose. Like the way I said, that it has a stable economy, the unemployment rate is very less. Okay, but when it comes to nurses, like since there's a huge gap, there won't be an unemployment case. Like then transportation, like the best transportation is that in terms of technology also Germany is ahead of all the other countries. You get free education, your children get free education, your spouse can join in after 6 months once you have cleared the recognition exam. Okay, then you can in terms of social security benefit, like this is a vast area. If you go to see about social security area, this covers your retirement benefits. In case if you lose your job, the government will be helping you out with at least 3 months salary. So these are some of the benefits that you would draw, and this is in return for the tax that you pay. Okay, unlike India where you pay the tax and you don't get any benefits in return, it's not in that way. The tax, that if you are paying your tax sincerely, then in that case all these benefits are waiting for you. Then when you are pregnant, okay, no hospitals can sack you. You are supposed to continue with your job, like they won't sack you during that period. Once you have delivered a baby, you won't find a crush over there in Germany which will support you taking care of your child for 1 year. What does that mean? That means that the government expects you to be with your baby for the next 1 year. Okay, so you need to, those time when you are unemployed, the government will be taking care of you, will be providing you with financial helps. So all these things are covered in your social security scheme. Work-life balance also is too good. Okay, so from you just have to work for 5 days in a week, and you are supposed to work for 7 hours. You will get your OT, you'll get holiday allowances, you'll get retirement benefits, all this. So you need to find out a reason what, from this list that I've given, from this you need to save the reasons that you means, that touches you for moving to Germany. So you need to give the reason why you want to move to Germany. Also, what made you choose nursing as your profession? Okay. And what was the most difficult thing in your while you were in doing the nursing course, or while you were doing the while you were working? All those things you need to discuss over there. Okay, so these are things that they are expecting. So turn by turn, I would expect that the number of candidates that we have over here who will be attending the interview on Friday could also speak on the same lines. Like, you can on the video and you can unmute yourself and speak for 5 or 10 minutes on this topics that I've asked you. Can Abhilash unmute himself as well as on the video?
Yes.
Abhilash, can you ask others, like, from your team, like from the candidates, like I can see Justina, Navina, Roxley, anybody, any one of them,
Yes, yes. They are open.
Hello, ma'am.
Yes, Amu, right?
That's my pet name. So my name is Manema.
Yeah. When you log in, like, for your interview, do not use pet names. What is the name that has been given in your CV? That name has to be shown over there. Okay, start.
Yes. So good afternoon, ma'am. Myself Manema. Basically, I am born and brought up in Bangalore, and I studied and my schooling, everything is done in Bangalore. So I have done my schooling in Bangalore Montessori School. It is in Bangalore. Till 10th, I have done my schooling, and after my schooling, my PUC I have done Vani Vilas College. It is in government. It's also in Bangalore for science.
What does PUC?
Second, uh, uh,
See, Germany doesn't understand these things. Why do you say, like, why Germany? Even I don't understand, because now I'm a person born and brought up in Bombay. Okay, so we don't use this terminology. So if you use PUC, I don't understand. So you need to be clear, like it is higher secondary school certificate, right?
yes.
Yes. So you need to say that.
Okay, thank you. Vani Vilas, I have studied there. It's a women college. I have done PCMB. I have taken physics, chemistry, maths, biology, and after doing my science, I have joined BSc nursing, 4-year course it is, and I have done that is in C College of Nursing under Rajiv Gandhi University of Health Science in Bangalore. So as soon as I finished my studies after 4 years, I have joined in Ambedkar Medical College for 1 year and 6 months as a nursing tutor. So after 1.5 years, I want to have a exposure in a clinical. So then I worked in a Sakra World Hospital, that is Japanese and Indian collaborator hospital. So there I worked for 3 years in a gynec and pediatric department. And so by the end of my 3 year, as I got married, I have conceived. So after to travel it is very difficult, so I resigned that job. And then I near my house clinic local, I joined in a clinical. It is a multi specialties clinic, that is trust. So there I worked for 2 years in multi specialty clinic. uh, um,
Okay. Amu, sorry, Mariam, right?
Maniamma.
Maniamma, can you tell me any one of the reason why you want to go to Germany?
Yes, actually, before I was not I'm not willing to go for abroad. When I was studying my BScs, all my friends used to say the reason we took BSc is to go for abroad. But during that time, I didn't have any mind to go for abroad and want to stay in Bangalore in India only. But after like recently, like 2 years before, like that, recently, like I want to go to Germany because I have heard a lot of testimonies from there, like the work, especially for women who go alone. There is more security. Social security is very, like, we have a good security. We don't need to fear with leaving husband or children to go out to be alone there. So that I have one main reason. Social security is very good, and there is a huge of opportunity for nurses. Comparing to any other countries, there is huge of opportunity and good facilities we have. Like some hospitals, they give attached, like rent house, attached house we have, and we no need to rush and go for the hospital also. So, and salary also is very good comparing to other states. And more most like extra benefits, like I see, like once after completing my RN exam, I can take my spouse and kids. We have free education for kids also. So these are the things I liked very much comparing to any other country.
Okay. So while you were working, what was it that you used to do? Like in which department did you work, and what was the work that you have done over there?
Yeah. So previous, like when I worked in Sakrapad Hospital, I was in gynec and pediatric department. So there, like for first 3 years, I was in OPD. So once I go to the OPD, I will arrange all the doctor consult. Before the doctor comes to the consultation room, I will arrange his every articles, everything. And once the patient starts to come, we will welcome the patient, and first we will do the vital checks, like height, weight, like example for pregnant mother, if she comes for the antenatal checkup, first we will check the height, weight, and then BP, which is very important to know whether the BP is normal before she goes for preeclampsia or what it is. So we'll check the BP and temperature, pulse, and once it is done, we document it, and then we will take the patient to the doctor's room. Then, like I will assist with the doctor by checking the fetal heart rate and note the fetal heart rates in the case sheet. Then, if doctor prescribes any injections or anything, we'll give it. Then when coming for the like pediatric patient, mostly I was having a vaccination. I was in vaccination room. So from the from 1.5 months, we'll start giving vaccination in our department. So vaccinations I was giving. So during first time I was not that skilled for giving vaccination. My seniors taught me how to do vaccination. Then by making the child, first I will make the child to comfortably attach to me. Then by smiling and making the child comfortable, then I will mother just hold the baby's leg, then we will take care, no need to worry. Then I'll just see the doctor prescription, what is the route, what is the dosage, what is the like side, everything I see it, and take this one vaccination and start giving the vaccination. As soon as giving vaccination, I'll tell the mother how to take care the baby, and if the fever or anything, what doctors prescribe, let the medicine will be given. Then we'll tell the next, when is the next dose she has to come, and what is the vaccination I have taken. I will stick it in that vaccination chart, and I will enter everything in the documented and sign date. Any side effect I will note down and write it.
Okay, good. So see, this was also a lesson for everyone else, like, who are there over here. This is how you need to speak, like, okay. So you need to speak in length, because each and every person will be given half an hour's time. Okay, so half an hour's time, you can't have one-liner answers or bullet points. You need to speak in length in this way, like the way we have Maniamma speaking. So in the same way, all of you all will have to speak when you have your final interview round with the client. Okay, so do we have the next person in ready for it?
Thank you, ma'am.
Thank you.
Hello, ma'am. Good afternoon. Myself, Anuradha.
Okay.
Ma'am, I'm working. I completed my diploma 3 years in the 2018, and I'm working in Apollo Hospital, Jayanagar in Bangalore since 4 years. I have a 4 years of experience, and I'm unmarried. Oh, and I choose this nursing professional because to make a patient feel comfort. I wanted to help to the patient. So when the patient their worst time, their difficult situation, so with giving by care and compassion and empathy, so that's and I thought I choose this profession. And the difficulties when the staff shortage during the duty times, uh, so- sometimes we faced a lot of difficulties in that during the duty time. So mm, I would like to work in Germany because I want to earn money, of course, and I want to settle my career. So this is what my I'm not
Nessie, you're
audible.
on mute. Nessie, you're on mute.
Yeah, I know. So these questions that I've mentioned, like tell me something about yourself, or like that one. Second one is like, why do you choose Germany? Why do you choose nursing? Why did you choose nursing as your profession? Okay, and what work do you do in a day in the hospital? Okay, so these four questions, just prepare yourself. Okay,
Oh,
write
okay,
down the answer for it, practice it daily, so you will be in a position to answer quickly when the client speaks. Okay, when the client asks, and remember this four questions answer, you will have to make at least 4 to 5 pages. Okay, and practice it. That is when you can speak for half an hour. Okay, and the same questions you will have to answer when the employer will also be taking your interview. Okay,
sure,
and at that time the answers you will have to give in German language. So if today you're prepared with the English one, okay, you just have to translate it, get it, like, check out whether the grammar is proper from your
no,
trainer who will be
oh,
training you up to B2 level. So from right now itself, from A1 level to B2 level, if you do this practice daily, then in that case you can make it. Okay, that's one thing. Second thing, while not only you, everyone over here, when you are learning the language, ensure that you have 100% attendance. Without attendance, you cannot make it. One day also, if you miss your class for German language, which is really very difficult language, you will not make it to B2 level. And in case, like, you miss it, try, speak to your trainer, keep him informed, and cover that portion that you have missed. And in a day, at least you will have to practice for 3 to 4 hours the language. So that is when you can make it. If you are focused, you can make reach B2 within 6 to 8 months time, or else you will go up to 2 to 3 years also. Okay,
sure,
so you need to be focused when you learn the language.
sure.
Thank you.
Thank you, ma'am.
Hi, I'm Virginia here. Nancy, I have a doubt which I wanted to clear.
Yeah, not a problem. Shoot.
Basically, I just got a call and with regarding to Mentric and all, I just came to know yesterday. So I haven't enrolled myself for any German language as of now. So am I eligible for the interview that you're talking about that happens on
Yeah,
Friday?
yes, you are eligible for the interview. You can give the interview. Okay, but joining for the German language classes. Okay, with Mentrix. Okay, they will guide you through about the levels and what are your timings and all that. Okay, they will arrange the classes in different batches, so they can accommodate all of you all according to your shift workings. Okay, the best part would be, like, you put at least 3 to 4 hours in a day to learn the language. Okay, and if you put that amount of time in your language, then in that case you can, within 6 to 8 months time, you can definitely make it to B2 level.
Thank you.
Thank you. Yes, Steffi, Christina.
Hello, ma'am. Good day. Good afternoon, ma'am.
Good
My
afternoon.
name is Christian Steffi Rajnikant. I am from Ahmedabad, and I pursued my nursing in 2014,
Mhm.
and I completed my nursing in 2017. And I completed with the degree of general nursing and midwifery, and then I started my job in 2017, LG Hospital, which is a government, which is a corporation hospital in Ahmedabad, and in operation surgical operation theater. And I'm a I think I choose nursing profession because of I think there is a hope to people in their worst time, and also we receive good news and become trusted, confident with the patient's family.
We receive.
Sorry,
Can you just come back on that? Repeat those.
receive good news to the patient's family and become trusted confidence.
Okay, receive good news. What is that?
Yeah, like if a patient has a in a bad condition, and then uh, we we told them that we are trying to heal to, so that that time they are very worried, and then we are trying, so they hope, like they that patient, that the relatives want that they relatives want that their patient is like uh, healing, or they are trying.
Okay. Okay. So, Steffi, when you answer these questions, brief. Carol, can you mute? So when you answer these questions, prepare your answer well in advance. Okay. Frame the sentences properly. Check out, like, the grammar is proper, and then answer. Okay. So you have
Okay.
time tomorrow when you are, like, on Friday when you are facing the client. Okay. Be prepared with these answers. Okay. How you start, how you end, and what, or, like, when you express your viewpoints, your ideas, it has to be clear, like, what you really mean by that. So just prepare yourself on it. Okay, that's
Okay,
it.
thank you.
Thank you.
Nessie, one doubt that I have is,
Yeah.
I think I heard an answer that I also want to earn money as far as going to Germany is concerned. So is that an accepted answer when we are talking to anybody there? There's no issues as such.
Only thing is, it had to be framed little better, like, that it has to be put in a better way than just bluntly saying that I want more money. Yes, money is always a factor that we are looking for. Okay, but then it could be said, like, in terms of salary also, the package is very good, and we will be able to live a better standard of life when we have a better payment, like, so the pay scales are definitely 100 times better than India. So those are, that's okay, but the
Okay.
only thing is
So
that
maybe you will need to
content,
say that, in terms of your salaries, your career growth, etc., you have much better opportunities there in Germany.
right. So she just has to make this sentence look, means, not just say, like, I'm going over there for the money. Like, instead of that, she has to make it clear, like, little bit. She needs to make frame the sentence properly.
Okay.
Carol.
Yes, ma'am.
Yeah, can you unmute and on the video? See, one of the reason why I'm saying that you need to on the video. Okay, see, if you go to see, look at me, I'm sitting in one place, like, I'm not moving around. So you should not move around. Okay, that's one thing. And like, up to your shoulder level. This is for everyone. Up to your shoulder level, we should be able to see you. And you should be in a quiet place, not where patients are going and coming. So be careful about these things.
Can I
Yes,
speak,
Carol,
madam?
yes.
Good morning, everybody. My name is Carolyn Chitra, and normally people call me Carolyn. I was born and brought up in Bangalore, done my early education in Bangalore. It is up to 9th standard I have studied in Bangalore, and then further I have gone to Tamil Nadu to do my further education, like the 9th, 10th, and also the 11th and 12th. In Tamil Nadu, we don't have the higher education as called as college. We had done it like regular students, and I've enjoyed even then I have enjoyed my education. And after that, I have pursued my nursing GNM in Gujarat, which is in Metas, Surat, which is in Gujarat. And I have done a 3 years course of GNM, and then we had an internship of 2 years where we'll have to serve the company. And I have worked in the medical surgical unit, which was what is that? Which was of my interest, and I enjoyed working with the patients who really needed my service. And the reason why I chose nursing was because I had a compassion and empathy for patients, and many times whenever I felt people struggling, it moved me. So that is when I decided to take nursing as my profession and serve them, and that would give me a kind of satisfaction. Later on, I've got married and moved to Hyderabad, which is in Telangana, and I have worked there over 9 years. And during my course of working, I have taken post BSc, which is a 2 year course, and I was allowed to work and study. So that was a very good opportunity for me. I have finished my post BSc in the year 2014, and I still had interest to study. So, because of my zeal to study, I have further taken MSc as my MSc, which is medical surgical as my profession. I'm in specialty and specialty, yeah. And I have completed my MSc in 2020. And the reason why I chose going to Germany is I heard that education is a little bit, education is free for us and we could study over there. And all throughout my journey, I really had difficulties financially paying my fees, but I didn't give up in my education. And I want to do my I want to do my PhD over there and simultaneously work and also give a good future to my family. And
Okay, that was good. Okay, so your goal is clear. You want to study further. No props. Just take proper breaks like during the talk. Okay, so you will be given half an hour and be prepared for your interview. That's it. Thank you. Next person.
Sonu has raised the hand. I think she can go. Sonu, you can start talking. Sonu, unmute yourself and you can start speaking.
Hello, actually, I had a doubt. For that only I raised my hand.
Can you on your
Hi,
video?
Nafsi. Yeah, okay, fine.
Yeah.
Hi, Nafsi.
Hi.
Yeah, so I completed my diploma in nursing in the year 2014. Okay, so then I did my internship also in Apollo. I did my study also in Apollo. So like after that, I worked as a medical coder actually. Means I didn't work as a nurse. Okay, I completely like my career was different. Like, I moved on to medical coding. So till now I'm working as a like medical coder in US company. So will I be like eligible for applying this
Your qualification. Can you? What is your qualification?
diploma in nursing?
That is of 3 years, right?
Yeah, 3 years and 6 months internship was there.
Yeah. No props.
Okay. Because these many years now I have experience in medical coding. So I just had a
What
doubt.
exactly do you do in that?
Uh, like it's medical coding. We convert
Medical
this.
coding. Okay.
Yes,
Okay.
yes,
Medical coding. Okay.
yeah,
Okay. No props.
yeah.
now do you want to move as a
Yes,
nurse?
yes, I want to move back to my profession which I studied. So
Okay, no problems.
yeah,
You can.
yeah. So because in between I had some issues. Because I have been infertility issue was there, so we have been taking treatment for that. So now I'm blessed with a baby girl. So now I'm happy, so I can move on to the next level. Like I can pursue my passion now. So I just want to move on to my nursing career itself. So I want to give a try. That's why,
Okay,
yeah.
so when you come for the interview, okay, be prepared and tell the reason why you choose medical coding in the beginning, okay,
Okay.
and why you want to quit from it and move to nursing, okay. So there is no props in it because they are more particular that you need to have the qualification, okay. So in case if this client doesn't accept, okay, I have another client, we will refer the other person, So
Yeah.
no
Okay.
props, just on Friday you give the interview. Let's see what the client has to say.
Okay.
Okay.
Thank you, Nati.
So Nessie, I think one request has come from many people. Probably, they also maybe in the beginning what you had spoken about the opportunity itself. If we can, go through it in once more, maybe the sharing the presentation. I think many of them missed, or they want to know a little more about it. So
Okay.
if we can just go through it, I think
Yeah.
that would be great.
Okay. So I'm not sure whether can you play that?
Abhilash, can you share the presentation as such?
Yes. Whether give me the tag screen presentation. 1 second.
Just a moment, I'll share the screen.
Yeah. I think Carol wants to leave for work, so.
Yes.
Yeah, no props.
Can I speak?
Yes,
Just a doubt. Maybe I have like 3 to 4 year gap I have because after my delivery there was no one to take care of my kids. So I have a gap. Is this fine that I can take it?
we will have to check out with the client, okay, because mostly in nursing field it is said that you should not have a gap, okay, but we will try to. I'll speak to Prashant about it first, okay, and then we'll just take this offline.
Okay. Thank you.
Thank you. In the meantime, can Justina speak?
Any issues in sharing the presentation?
No, you can share the presentation.
No, I'm just asking Vedavati. I think it's taking time.
Just a moment.
Okay, over here, can we go directly to the third slide?
Third slide, Vedavati.
Yeah.
Abhilash is sharing.
Abhilash, slide number 3.
Can you see this?
No, no, no. It's gone out of the presentation.
No.
No.
Okay, but I'll just take you through. Okay, the first reason is there's a shortage in Germany for nurses. Okay, which gives you ample amount of opportunity over there. Okay, so when there is a scarcity for nurses, you definitely can make your way over there. Okay, so if, like, whether you are a diploma holder or a BSc holder, degree holder, doesn't matter. They just need any one of the qualification. Okay, so that's one thing. The next thing that I want to say is about the reasons why you can relocate. Okay, when it comes to the economy, it's strong and stable. Okay, the second thing is the unemployment rate in Germany is quite low, and when there is a shortage of nurses, unemployment in this industry or in the nursing industry or the healthcare industry will not take place. Okay, so you at any given point of time you will have a job in hand. Okay, the third important or top reason is like the integration has been taken care by the government. Okay, the government takes a lot of spends a lot of money in integrating you into the country. Okay, so how are they integrating you? They are bringing your qualification to the standards of Germany by the adaptation program. That's one. Second thing is, once you have completed 3 years, they give you permanent residency. Fourth, if you have completed 5 years, they are giving you citizenship. So their expectation is that you settle down in a country like Germany. Okay, so these are some of the benefits of moving to Germany. And the employment conditions over there is too good. The reason behind, they have a strong labor union. Okay, so you can make your complaints if you have any issues, and that has been taken care over there. Accordingly, they have made changes, like, unlike in India where you would have to work for 10 to 12 hours, over there it is like, already fixed. You just have to work for 7.5 hours or 8 hours maximum, and you will be paid overtime. You have holiday allowances, you have shift allowances. Okay, so your starting salary, which is going to be minimum 2,000. Now, last time when we had an interview with the client, the starting salary was 2,500. Okay, there would be an increase when you complete your nursing registration exam. So that would be minimum 2,900. With the OT, holiday allowances, your benefit is going to be, or the take home is going to be 4,500 euro, which is close to 5 lakh rupees in India, which I don't think you will be able to make it if you are working in India, right? So in terms of work-life balance also, like, you have to work only 5 days a week. You get Saturday, Sunday off. You can plan your vacations or you can plan your holidays to any part of Europe. Transportation is good over there. And once, like, if for women who are pregnant can take up part-time jobs, they can also take a break in service. During the break in service, the government would be helping you out or would be helping you financially. You have maternity leave, you have paternity leave. Once you have the baby, you are expected to be with the baby for 1 year. So these are some of the benefits which you will not find in any other countries, or you will not get it in India. Okay, so these are the reasons why you could think of moving to Germany. So you can include any one of these reasons in your answer. Like, Is that okay? Oh, shucks. Hello?
Yes, human.
Yeah, okay. So do I speak more about it, or these points you could include in your answers, or do you want some more points like?
Let's clear their doubts if they have.
Okay. Okay. Does anyone have any questions like?
I think Justina is trying to speak, but
Justina, can you? Yeah.
Good evening, ma'am. My name, Good evening, ma'am. First of all, thank you for giving this good opportunity. My name is Smita Anjani. I am from Kerala. I have completed General Nursing Midwifery, Central School of Nursing under the Holy Family Education Trust during the year of 2003 to 2007. I have 14 years experience. Now I am working from City Hospital Ernakulam Surgical ICU. I am married. My husband name is Jojo Baby. She is AC technician. I have only daughter. Her name is Justina Jojo. She is studying in 7th standard. My best I should select it to Germany. Germany is a most developing country, good job securities and good transportations, health, excellent health care system and high standard of living.
Okay. Okay. So you want to move
Now,
to Germany for living a better standard of life, right?
yes, ma'am. Now I am study in B1 German language in Ernakulam.
Okay, okay, good, good, good. So when you have your interview with the client, what you can do is you can speak in German. Okay.
Yes, ma'am.
Yeah. So these questions which I have asked you, like you can prepare yourself in German language and speak in.
Okay, ma'am. Okay.
Okay. Yeah. Good, good.
Thank you, ma'am. Thank you, ma'am.
Yeah, there was a question about food and accommodation. Okay, food and accommodation is given only by Middle East countries. Okay, and not by Europe. Europe, when you move to Germany, you will have accommodation near to the hospital at a subsidized rate. Okay, the salary over there is more. So once you have, like, cleared your registered nurses exam, you will be getting your family over there. So in that case, you need to move to your own accommodation, and the accommodation would be around, 250 or 500 minimum to maximum, depending upon the type of flat or accommodation that you would choose. So the whole expense will depend upon the type of lifestyle that you would be living. But having said that, a person who earns at least 2,300 euros per month can save easily 1,000 euros over there. Okay, accommodation, say if 500 goes for accommodation, 150 for tax. Okay, another 2 or 300, maximum 200 will be spent as a single person in Germany for food. Okay, so the remaining money would still be your saving.
Any more doubts or clarifications, or anybody else wants to speak up?
Ma'am, just a one doubt.
Yeah.
You're on mute, Justina.
Justina, can you unmute yourself?
Ma'am, which time they bring my family?
Once you have given the nurses registration exam in Germany, okay, you can then you have to pass that exam definitely. After that, you can take your family.
Okay, ma'am. Okay, thank you.
Okay, so that again depends upon your pro recognition that is being done. Once your pro recognition has been done and the document comes, we'll come to know how long will it take for you to clear your exam. So it would be minimum 6 months, okay, to a maximum of 8 or 9 months, 10 months also. So after that, you need to give your exam, and mostly in terms of hospital, if you choose hospital, the exams are not very difficult. Okay. And
Okay,
if you have fluent with your language also, you can clear it, because there's a lot of part of it that is done practically. Okay, so you earn in your practical, and you can definitely clear your exam.
okay, ma'am. Okay, thank you.
Anybody else?
Any other clarifications? So Abhilash, anyway, you will be in touch with all the candidates. If they have any other doubts or anything like that, you can just collect them, and we can get it clarified.
Of course, sir.
Yeah.
Yeah, sir.
So if no clarifications and questions and nobody to speak up, I think we can wind up the session.
Yes. If there.
Okay. I believe that there are no clarifications and nobody else to speak up. So thank you, Nessie, for joining us.
Yeah,
Thank you to all the candidates. So
Thank
we
you,
hope
sir,
that
and thank you, ma'am.
we will take up the whole thing and be in Germany as far as the next year is concerned. We celebrate the New Year in Germany. Thank you so much,
Okay,
all of
thank
you,
you.
for joining us.
Thank you.
Thank
Thank
you.
you, sir. Thank you, ma'am.
Thank you.
Thank you
Bye.
so
Bye.
much.
Bye.
Hello.
Yes, yes. You can
Uh,
leave. Is
okay.
there any clarification?
Yeah, I have one question.
All right. Why did you ask that time? Not a problem. You can shoot.
Uh, that time I'm very little busy. That's why I'm not.
Oh, all right.
Yeah. Can I ask right now? Yeah.
Okay. Right now, or else I will call you.
Okay. Okay. You call me. Okay.
Oh, sure, sure. I'll call you.
Thank you.